My story with WIHD goes back a long ways. I used to cut classes in medical school to come up to some of the multidisciplinary care conferences for people living with disabilities that were being held at WIHD in the early 1970s. This interdisciplinary approach was truly something new. This was a way to bring neurologists, occupational therapists, speech language, and all of the different disciplines that tend to children with multiple disabilities all together. WIHD was not only a pioneer, but they also were among the very first university-based centers. This affiliation between WIHD and New York Medical College has sustained itself for several decades. Why? Because New York Medical College needs the clinical interaction with the staff at WIHD to learn how to care for children and adults with disabilities. And WIHD benefits from the university affiliation. We formed a Center on Disability and Health around the time that I became dean. We envisioned a center that would bring WIHD staff into the faculty at New York Medical College. WIHD is very important to the teaching program at New York Medical College. We have some 1,600 students, many in different disciplines, ranging from medicine, dentistry, public health, physical therapy, PhDs in biochemistry and cell biology. Every one of them has a need of their own to learn more about underserved populations, including people living with disabilities. WIHD provides my students with endless opportunities to mix the practical with the academic so that we get the best trained clinicians going out there in the future. The Touro College of Dental Medicine at New York Medical College now provides a week-long rotation at WIHD, so the dental students get an opportunity to treat children with disabilities.
We're learning every patient has their own autonomy, and like you treat them as you would anyone else, and that you have to kind of adjust to sometimes some patients are more sensitive to certain things, and you want to be able to accommodate that.
The LEND program is another one of our triumphs at WIHD and New York Medical College. It stands for Leadership Education in Neurodevelopmental and Related Disabilities. It's a federally funded one-year program that has trained of graduate students, postdoc fellows, existing leaders of disability centers, self-advocates, and even family members. Our hundreds of graduates of the LEND program are out there across New York, across the country, even in the Caribbean territories. When we support WIHD financially, we not only feel good about what we've just done, and we do, but we also become part of a very long chain of fine people over many decades who have worked very, very hard to improve the lives of people living with disabilities. And yet, there's another dividend, because by supporting WIHD, we are also supporting the future training and the future competence of thousands and thousands of physicians, therapists, scientists, and others who will make their contribution. That's not a small thing at all.